today's topic is types of reports. Spontaneous voluntary report, clinical trial and post-marketing studies, regulatory reports, license partner report, literature report. One report is received, it is checked over following four parameters. There are four considered valid cases: identifiable patient, identifiable reporter, a drug suspected of causing reaction event, adverse event, or fatal outcome. Each report can make a difference. Type of reports provided to regulatory authorities. Pharma companies are required to report safety information to regulatory authorities according to specific timeline. This mandatory reporting include expedited reporting, periodic reporting. Now, what is expedited reporting? Worldwide regulatory authorities require expedited submission of individual safety reports received by drug companies that meet certain specific criteria, including criteria for a seriousness of clinical event, whether or not a report has been previously observed, and an assessment of the event relatedness to administration of the product. The decision on when and how to report individual case reports are based on the requirement of each country's local law. Now, expedited reporting timeline. First, three categories there are. The first one is clinical death, then second, clinical trial, other serious cases and safety issues are reported in 15 days time frame. Serious post marketing cases are reported within 15 calendar days. Non-serious cases are reported within 90 calendar days. Now, what is periodic safety reporting? Periodic safety reports are submitted to regulatory agencies in accordance with government regulation. The purpose of these periodic safety reports is to provide an aggregate review and analysis of all adverse event reports received over a defined time period. Periodic reports provide an overall safety re-evaluation at defined time point and contribute to the ongoing assessment of whether changes should be made to product information or the risk management plan. The timing of the content of a periodic reports of marketed product are based on local requirements. In most countries, post-marketing periodic report are referred to a periodic safety update report. In the United States, these reports are referred to as a periodic adverse drug experience report. Then drug safety report, that is DSUR, drug safety update reports. Then periodic safety reporting timeline, then regulatory actions. What is off-label use? Unapproved use of approved drug is often called off-label use. This term can mean that the drug is used for a disease or a medical condition that is not approved to treat, such as when a chemotherapy is approved to treat one type of cancer, but healthcare providers use it to treat a different types of cancer. Then a medication error. A medication error is any preventable event that may cause or lead to inappropriate medication use or a patient harm while the medication is in the control of the healthcare professional, patient or consumer. I will see about the specific population in PV. Dosing consideration of vulnerable population. Vulnerable population means are groups of patients with a high risk for adverse drug effect require careful dosing and or medication selection. At-risk group include men and women of reproductive age, pregnant or breastfeeding women, children and infants, elder patient, people with renal or hepatic disease, obese or underweight patient. Reproductive age means in human, especially in women, Drug can affect fertility or damage ova. In men, drugs can alter sperm quality and quantity. Pregnancy category A, B, C, D, X. The A category means the studies in pregnant women has not shown a risk to the fetus. B. Animal studies have not shown harm to fetus, or animal studies have shown fetal harm, but studies in pregnant women did not show risk. C. Animal studies show an adverse effect, and there are no adequate studies in pregnant women.